Hi everyone, my name is Kenisha Brown. This is my presentation on catheter-associated urinary infection, otherwise called Cauti. What is Cauti? Cauti is one of the most common hospital infections a person can contract during stay. Indwelling catheter are the causes of 75% of urinary tract infection. What is indwelling catheter? Indwelling catheter is a tube inserted into your urethra to drain urine from your bladder into a collection bag. What causes Cauti? Cauti is caused from bacteria or fungi enter your urinary tract through the catheter. Other causes are catheter may not be regularly cleaned, drainage bag may not be emptied often enough, catheter may become contaminated upon insertion, bacteria from a bowel movement may get on the catheter, urine in the catheter bag may flow backward into the bladder. And there's a picture with my catheter bag being full. Cauti risk factors. The first thing we need to do, we need to minimize use of indwelling catheter in all patients, especially those at higher risk of Cauti and mortality. The risk factors are elderly, women, catheter blockage, impaired immunity, prolonged catheterization, improperly trained personnel. Signs and symptoms of Cauti. You'll have chills, fever, dysuria, vomiting, hematuria, cloudy urine, strong urine odor, unexplained fatigue, pressure, pain, or discomfort in your lower back or stomach. And you can see I have a picture with a lady holding her back and a picture of the tube and the catheter bag with blood. How to treat Cauti. Cauti usually treated with antibiotics. Urine culture done, then bacteria is being treated based on culture results. Some examples of antibiotics are macrobid, rocephin, Keflex, Bactrim. Those are ways we'll treat the Cauti infection with some antibiotics. The biggest thing about the treatment is always complete your course of antibiotics. Never you stop without contacting your primary care physician. Next slide, impact of Cauti. There's a few impacts here. Cauti is a preventable infection and can also be deadly. Cauti represents 13% of hospital-acquired infection. Cauti is associated with an excess length of stay of 2 to 4 days. Cost per patient associated with Cauti is approximately $1,000, which is a lot. Cauti make up 2% of excess costs in U.S. hospitals associated with all hospital-acquired infections. Cauti are associated with an increased cost of $400 million to $500 million annually. Cauti are no longer reimbursed by CMS as of 2015. Excess costs associated with this hospital-acquired infection are no longer covered by Medicare or Medicaid. Cauti rates are examined as part of CMS Hospital-Acquired Condition Reduction Program. If a hospital has a high rate of Cauti, as well as other hospital-acquired infection, it can face a 1% reduction in Medicare payment as part of the program. CDC estimate that 17% to 69% of Cauti can be stymied with recommended infection control measures. These are some ways to prevent Cauti. Okay. You want to clean around the catheter each day. Keep the catheter tube from kinking. Keep the drainage bag below your bladder. Change the catheter at least once per month. Empty the drainage bag several times per day. Wash your hands before and after touching the catheter or drainage bag. Insert catheters only for appropriate indication. Leave catheters in place only if needed. Ensure that only properly trained person insert and maintain catheters. Insert catheters using aseptic techniques and sterile equipment. Following aseptic insertion, maintain a closed drainage system. You can see closed urinary drainage and my little image where it says do not lie on tubing because that could cause backflow. Hang bag on the frame of bed, not on the railing, because you could hang it on the railing and someone either pull the railing down or pull it up and yank the Foley catheter, which will cause damage, and it could be very painful. Also, I have an image where, they're washing their hands for at least 15 seconds. And an image of my catheter sterile kit. Those are some ways how to prevent Cauti. Next slide is my recommendation strategies. Implement recommendations for use. Insert and maintenance. So some of the strategies are ensure compliance with recommendation, use alternative to indwelling catheterization, portable ultrasound devices to do bladder scan, antimicrobial or antiseptic impregnated catheter. So instead of catheter, you could do like a bladder scan to see, if there's a lot of urine in the bladder. You can also ensure compliance where, you follow the policy of having a urinary catheter on the unit. The next slide is implement quality improvement programs. You could have like alerts or reminders on the computer. If you have such patients with a Foley catheter, you could have something maybe at the nurse's station where it informed you what patient it is and how long the catheter is there and what's the purpose of the catheter. Because you don't want to keep a catheter in too long because it could cause really bad infection. The next thing you could do is like a stop orders. So patients show up on the unit with a Foley catheter. You need to find out what's the purpose of the Foley catheter. And go from there by informing the doctor and try to get an order to discontinue the Foley catheter if it's not necessary, or at least start a bladder training to work your way on DCing the Foley catheter. The next one is having protocol for nurse directed removal of unnecessary catheters. So you could have that as a protocol for removal of unnecessary catheter, especially those that doesn't have a diagnosis. They just use it for surgery and they came back from surgery and still have the catheter. We need to try to get orders to get rid of those catheters to prevent these infections. The last one is guidelines for appropriate perioperative catheter management. Those are some good recommendation strategies you could follow. And I also have my bladder scan and I also have my little wallpaper accent why the Foley. Those are some good reminders. Now we move on to the next slide, which is my reference. And that's the hand. I hope you guys enjoy my presentation. Thank you.